Okay, this is skill 1 for CERT skills. With that one, sorry with my motion there. Right, you're 2 rescuers in CERT skills, and so on treating life-threatening conditions, one of you is going to go one direction, one of you is going to go another direction as far as treating patients. So that one of you is going to go ahead and take opening the airway. Rescuer 1 is the rubric that you'd follow on page 5. I have the national ones in front of me and not the Montana short sheets, but rubric 1, skill A, is for rescuer 1, and that's what I'm going to show you right now, which is opening the airway, whereas your partner, rescuer 2, is going to do controlling bleeding, and I'll do that one in a separate video. That way you can kind of watch them. You might decide this ahead of time, that if you were to draw this one, who's going to be in charge of what. But again, in HOSA, the goal is for you to be learning skills, so it's great for you both to learn these skills. I hope you're going through the whole CERT skills training program and finding that through FEMA online so that you can know more about this. So every scenario like this, you're going to don both of you at the same time on the rubrics your personal protective equipment. Again, in this, a lot of it can be simulated, but you're going to don a helmet, gloves, dust N95 mask, boots, and that kind of stuff. And so you can say all that. I've verbalized each one of those for that point. You're going to verbalize that you're checking the scene for safety and doing a thorough scene size up there. And then you're going to identify and find your patient. It's going to be a full mannequin probably, or it might be a person next to an airway mannequin like this. So this is an airway mannequin, and it allows us to do both head tilt chin lifts, jaw thrust, which I'm going to demonstrate. We can insert special training tools into this for intubation. And obviously we wouldn't want to necessarily do that on a live human. So we would have a mannequin there that's able to do a jaw thrust maneuver. Some of the CPR mannequins can't do that, so we would make sure we got you a good mannequin that you can do that, and I'll show you what that looks like on him. So you're going to identify your patient, and we're going to check for their level of responsiveness. So you're going to go ahead and kind of, can you hear me? And the judge will let you know that there's no response, that you have an unresponsive patient at this point. And you're going to go ahead and kind of look, and you're going to assume and verbalize that you suspect an airway obstruction of some kind. Because this patient was, in theory, some kind of a trauma patient, due to the nature of this CERT skill event, maybe there was an earthquake, maybe there was, some kind of structural type issue, we want to use a jaw thrust maneuver instead of a head tilt chin lift, which could compromise their cervical spinal area. And we would use that more on a CPR patient that's more of a medical patient that we don't suspect that trauma with. So we're going to do a jaw thrust, and so you're going to kneel at the patient's head, and you want to be at the back of their head over here when you do a good jaw thrust. And I'll get closer and I'll kind of show you this up close on the thing. But the way that you'll do this is you're going to kneel there. Your thumbs are going to go up here on their cheek, and then your fingers are going to pull up on their jaw. So let me kind of bring this at an angle that you can see there. So my thumbs are here on their cheek, and I'm going to pull up on their jaw like this in order to open that airway up. And so you're going to go ahead and do that. The judge will let you know that your attempt to open the airway was successful. And now we want to put your patient into the recovery position. So again, I just have a head mannequin here, but we're going to roll them. Usually on their left side is ideal because of their vena cava and the way that blood returns to the body. We want to keep the body's weight and organs off of that if we have the choice. So usually left side's preferred. And so you're going to lay them on their side. And when you do that, you're going to follow the rubric guidelines, and we put one arm below them like this, and then their top arm is going to lay on their bicep, and their head can lay on top of that, right? And I'd be laying out all the way. You're going to go ahead and verbalize that you would bend their legs a little bit and tilt their chin forward, so that way if they were to throw up or vomit as they're unconscious, that would go downhill, and it wouldn't be something that they would aspirate or choke on. So that recovery position looks something like, if I don't fall here, this with the bent knees. They're laying their hand on their bicep and rolled down. That way if they were to get sick, it would come down this direction. So that's a life-saving skill of opening the airway. And we'll do a different one for your second rescuer.